This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about what to do if you tore your rotator cuff. So the answer is it depends how bad you tore it and depends how much pain you have. So most joints, like the hip is like a ball and socket joint where there's a lot of coverage. The shoulder is a little different. It's more like a golf ball on a golf tee. A lot of range of motion there. And what the rotator cuff does is it helps keep the golf ball on the golf tee and the tendons come over. Most of the movement of your arm, it comes from your deltoid muscle, which is a much bigger muscle. So the rotator cuff muscles are strong and they basically help keep the shoulder centered where it's supposed to be. So if you tear it all the way through, the shoulder will start to be pulled upwards by the deltoid and that can cause problems. So the question is what to do if you have a rotator cuff tear. So let's say you've got an MRI or somebody diagnosed it. First of all, it depends if it's a partial thickness tear or a full thickness tear and your associated pain, and also how old you are. So if it's a partial thickness tear and it's not all the way through, it usually means that the rotator cuff is functioning okay and it's doing its job that it's supposed to do, which means that your humeral head is not rising upwards. So it's keeping the golf ball on the golf tee, so it's functioning. The partial thickness tears are more an issue of pain. So what I would do first is definitely try some physical therapy and a steroid injection, and sometimes with those it can basically get rid of your pain even if you have a partial thickness tear, as there's a lot of people walking around with partial thickness tears in their shoulder or the rotator cuff who aren't even aware of it. Especially as the older you get, the more likely you are to have a partial thickness tear that you don't know about. So the first thing is to try those modalities and see where you are. And if your pain is not that bad and your rotator cuff's functioning, then you can kind of live like that indefinitely. Now, if you have intractable pain and it's a deep tear, then you may need surgery to basically repair that tear. If you have a full thickness tear, that can cause you problems in the long run. Usually they're very painful. So if a tendon is torn all the way through, most people have pretty bad shoulder pain. Therapy and injections are not going to help heal that. Some people use things like PRP or some use stem cells. They're not going to heal a full thickness tear. They may help with a partial thickness tear. But if it's a full thickness tear, the problem that happens is over time, your shoulder, the humeral head or your shoulder will start to move out where it's supposed to be, and it can lead to bad arthritis of your shoulder. So that's something that you probably want to get repaired surgically, especially if it's painful, especially if you've torn multiple tendons. Now, if you have, there's an exception to that. If you have a full thickness rotator cuff tears and your tendons have been torn for so long, this happens that all the muscles have atrophied, meaning that there's a muscle that goes to those tendons, and if you don't use them because they tore, the muscle will disappear and atrophy. Then sometimes it makes sense to do a rotator cuff repair, but you may be looking at a partial rotator cuff repair or skipping it altogether, because even if you repair those tendons and are able to get them all the way back onto the humeral head, the rotator cuff still might not function or won't function properly. So those are kind of your options. If it's a partial thickness tear, definitely try conservative treatment first. You may be able to be just fine. If it doesn't hurt, leave it alone. If it's full thickness and it's bothering you, you probably want to get surgery on it. So I was able to answer your questions about what to do if you tore your rotator cuff. If there's any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, although I can't give you specifics about your medical situation or give you your specific medical advice over YouTube. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.